Before any of our patients are examined in our fertility clinic, we like to remind them of these few things: that 1 in 7 couples will have trouble conceiving, and reasons they may have trouble conceiving, they may be over the age of 35 or their partner is over the age of 35. They have a history of smoking. The woman often will have irregular periods. If they are underweight or overweight, if they continually participate in physical labor or excessive exercise, if they substance abuse, and if they have had radiation therapy and or chemotherapy, and if they have high blood pressure. This is just some of the factors that could contribute to why they may have trouble conceiving. Today we will be examining 3 different couples. We have Stephanie and David, Dave and Michelle, and Henry and Nia. First, starting with Stephanie and David's exam, both of their results show that their blood work is clean. However, Stephanie complains of painful periods as well as complains of slight pain in her abdomen. Since Stephanie was complaining of pain in her abdomen and painful periods, we decide to proceed with an HSG. An HSG is an X-ray used to examine the inside of a woman's fallopian tubes to help determine if the tube is blocked or damaged. So Stephanie ends up getting diagnosed with having a blockage in her fallopian tube. Luckily, the blockage is near her uterus, which means she has a greater chance of getting pregnancy if she decides to have surgery to remove the blockage. My first treatment option is a laparoscopic surgery to remove the blockage. The average cost in the United States is about $17,000 without insurance. The success rate is up to 60 out of 100 women are able to get pregnant after their surgery. Some risks of the surgery include the chance of having an ectopic pregnancy, which is what happens when a fertilized egg grows outside of the uterus, usually in a fallopian tube. General anesthesia risks and possibility of pregnancy taking longer than compared to IVF treatment because of recovery time required by surgery. And health insurance may not always cover fallopian tube surgery. If the couple decides that they don't want to do the surgery, then I would suggest the IVF treatment. This is a treatment in which the egg is fertilized outside of the body and we put the resulting embryo back inside the body. The average cost of this is $12,000 to $17,000 for one cycle without medication. The success rates are that women under the age of 35 see a success rate of about 53.9%, while women ages 35 to 40 see a success rate of about 26 to 40%, and women 41 and over see a success rate of about 3.9 to 12.6%. This would give Stephanie a greater chance of conception, seeing as she is under the age of 35, giving her success rate about 53.9%. The risks of IVF treatment could possibly be multiple births, premature delivery and low birth weight after delivery, ovarian hyperstimulation syndrome, which is when the ovaries become painful and swollen, miscarriage, egg retrieval complications, ectopic pregnancies, birth defects, and stress, since this procedure can be mentally, emotionally, and financially stressful. In Michelle and Dave's exam, it is found that Michelle often has irregular periods or no period at all. Michelle is given at-home ovulation test to see if she's ovulating regularly. The ovulation appears to be irregular, diagnosing her with polycystic ovary syndrome. My first recommendation is to put Michelle on oral drugs to increase how many eggs Michelle will produce during an ovulation period, as well as regulate her ovulation. The cost is anywhere from $10 to $100 a month, and the success rate is about 60 to 80% of these women who take the oral drugs will ovulate. About half of them will become pregnant. These oral drugs can be accompanied with some symptoms including bloating, headaches, hot flashes, nausea, and blurred vision. It can also cause something called ovarian hyperstimulation syndrome, which is swollen or painful ovaries, and in some rare cases can cause ovarian tumors. If these oral drugs do not help the couple conceive, I would recommend going forward with IUI, which is in-uterine insemination. This is a fertility procedure that prepares a sperm sample and inserts it into the uterus to increase the odds of conception. The sperm can be from a partner or donor. The cost is about $300 to $1,000 without insurance per IUI cycle, and the success rates are women ages 20 to 30 have a success rate of about 17%, while women over 40 have a success rate of about 5.4%. Some of the risks with IUI include infection from the needle, spotting, or a small amount of vaginal bleeding, as well as multiple pregnancy. Next up, we have Henry and Nia. From their exams, it appears that Nia's blood work and exam is clean, while after testing Henry, it appears that he has a low sperm count. Henry tells me that he often uses the sauna at his local gym, and high heat areas such as saunas or hot tubs can lead to a low sperm count. My first recommendation is to put Henry on a healthy diet and that he avoids toxins such as smoking, alcohol, and drugs, is that he remains active as well, but also avoids high temperature areas like saunas and hot tubs. If all of these factors do not result in conception, I recommend that IUI would be the next step. IUI also has a process called sperm washing, which help wash out the unhealthy sperm, only injecting the mother with the healthy sperm, hopefully resulting in the success of conception.